Novel Coronavirus Disease 2019 COVID-19 1. Symptoms. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease cases. The following symptoms may appear 2 to 14 days after exposure. Fever, cough, shortness of breath. 2. How to spreads novel coronavirus. The virus is thought to spread mainly from person to person. 1. Between people who are in close contact with one another within about 6 feet. 2. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It may be possible that a person can get novel coronavirus by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. How easily a virus spreads from person to person can vary. Some viruses are highly contagious, spread easily, like measles, while other viruses do not spread as easily. Another factor is whether the spread is sustained, spreading continually without stopping. 3. Steps to prevent illness. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to this virus. Between people who are in close contact with one another within about 6 feet and through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. 4. Stigma and resilience. Public health emergencies, such as the outbreak of coronavirus disease, as stressful times for people and communities. Fear and anxiety about a disease can lead to social stigma toward people, places, or things. For example, stigma and discrimination can occur when people associate a disease, such as novel coronavirus, with a population or nationality, even though not everyone in that population or from that region is specifically at risk for the disease. Stigma can also occur after a person has been released from novel coronavirus quarantine, even though they are not considered a risk for spreading the virus to others. Some groups of people who may be experiencing stigma because of novel coronavirus: persons of Asian descent, people who have traveled, and emergency responders or healthcare professionals. Stigma hurts everyone by creating fear or anger towards other people. Stigmatized groups may be subjected to social avoidance or rejection, denials of health care, education, housing or employment, physical violence. 5. What to do if you are sick. Steps to help prevent the spread of novel coronavirus. If you are sick, stay home. People who are mildly ill with novel coronavirus are able to isolate at home during their illness. You should restrict activities outside your home, except for getting medical care. Avoid public areas. Do not go to work, school, or public areas. Avoid using public transportation, ride sharing, or taxis. Stay away from others. As much as possible, you should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom, if available. Limit contact with pets and animals. You should restrict contact with pets and other animals while you are sick with novel coronavirus, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with novel coronavirus, it is still recommended that people sick with novel coronavirus limit contact with animals until more information is known about the virus. When possible, have another member of your household care for your animals while you are sick. If you are sick with novel coronavirus, avoid contact with your pet, including petting, snuggling, being kissed or licked, and sharing food. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with pets and wear a face mask. Call ahead. If you have a medical appointment, call the healthcare provider and tell them that you have or may have novel coronavirus. This will help the healthcare provider's office take steps to keep other people from getting infected or exposed. If you are sick, you should wear a face mask when you are around other people, those are sharing a room or vehicle or pets, and before you enter a healthcare provider's office. If you are caring for others, if the person who is sick is not able to wear a face mask, then people who live with the person who is sick should not stay in the same room with them, or they should wear a face mask if they enter a room with the person who is sick. Cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in a lined trash can. Wash hands. Immediately wash your hands with soap and water for at least 20 seconds or, if soap and water are not available, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Clean your hands often. Wash hands. Wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Hand sanitizer. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water are the best options if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Please share this video to avoid more casualties and stay protected from novel coronavirus. Thanks for watching.